Hello and welcome to G Fun Facts Online, the show that digs into the science behind the headlines. Today, we're journeying into a fascinating and, until recently, controversial world. We're talking about a new era of medicine, one that looks to an ancient organism to heal the modern mind. We're talking about fungi, specifically, the active compound in what are commonly known as magic mushrooms, psilocybin. What was once a symbol of the counterculture is now stepping into the bright lights of clinical research, promising a revolution in how we treat mental health. This is the world of myco-therapeutics, a blend of ancient wisdom and cutting-edge science. Let's get into it. For thousands of years, cultures around the world have used psilocybin mushrooms in spiritual and healing rituals. Some archaeologists even point to rock paintings in Western Australia, suggesting these practices could be over 10,000 years old. This ancient use eventually sparked scientific curiosity in the mid-20th century. In the 1950s and 60s, researchers saw huge potential for treating anxiety, depression, and addiction. But this promising work came to a screeching halt when psychedelics were banned worldwide. Now, after decades in the scientific wilderness, we are in the middle of a psychedelic renaissance, and the evidence for its benefits is becoming too powerful to ignore. So, how does it actually work in the brain? Well, psilocybin itself is what's called a prodrug. That means it's inactive until your body works its magic on it. Enzymes in your body quickly convert it into its active form, psilocin. Psilocin then goes to work on the brain's serotonin system, specifically targeting a receptor known as the 5-HT2A receptor. Serotonin is a key neurotransmitter that helps regulate our mood, our thoughts, and how we perceive the world. By latching onto these receptors, psilocin can induce profound shifts in consciousness, mood, and perception that typically last for 3 to 6 hours. This is what's commonly called a trip. But the real therapeutic power seems to come from its ability to hit the reset button on the brain's wiring. Researchers at Washington University found that psilocybin temporarily scrambles what's known as the default mode network, or DMN. Think of the DMN as the part of your brain that's active when you're daydreaming, thinking about yourself, or ruminating on the past. In people with depression, this network can become overactive, locking them into rigid, negative thought patterns. By disrupting this network, psilocybin seems to create a window of opportunity for the brain to break free from these old ruts and form new, healthier connections. It doesn't just disrupt old patterns, it helps build new ones. Studies have shown that even a single dose can promote neuroplasticity, which is the brain's amazing ability to rewire itself. It can physically increase the number of connections between nerve cells, and these changes can last for days. This enhanced brain flexibility might be the key to the incredible results we're seeing in clinical trials, and the potential applications are staggering. Some of the most compelling evidence is for treatment-resistant depression. Research from Johns Hopkins Medicine showed that psilocybin therapy, when combined with psychotherapy, produced substantial and lasting antidepressant effects, with some patients remaining in remission for up to a year. It's also shown incredible promise for reducing anxiety and distress in patients with life-threatening cancer diagnoses. And get this, a 2014 study on using psilocybin to treat nicotine addiction found an 80% success rate at the 6-month follow-up. That's a huge number. Researchers are now exploring its use for PTSD, OCD, anorexia, and even chronic pain conditions. The world is taking notice. Australia has already authorized psychiatrists to prescribe psilocybin for treatment-resistant depression. Here in the United States, several states are decriminalizing or legalizing it for therapeutic use, and the FDA has granted it a breakthrough therapy designation, which fast-tracks its development. The DEA has even massively increased its production quotas to meet the demand for research. Looking ahead to 2025, major universities like UCLA, UCSD, and UCSF have trials planned to study its effects on everything from depression and Parkinson's disease to phantom limb pain. Now, it is crucial to state that this isn't a DIY cure. The psychedelic experience is incredibly powerful, and all this research is happening in a controlled, clinical setting with trained therapists to guide patients and ensure their safety. The journey of psilocybin from an ancient sacrament to a modern medicine is truly remarkable. It's a testament to the power of nature and a sign that we may be on the verge of a genuine revolution in mental health care, offering new hope to millions. Thanks for tuning in to G Fun Facts Online. We'll see you next time.